And here's the thing. Should we be worried by this increase in COVID cases? I'm not a medic, but I am, I suppose, an optimist. So hear me out on here, and I promise you, if I'm chronically naive on this, or I'm missing a wider point, then I'm all ears. Two of the government's top scientific advisors have given stark warnings over the increase in cases. So this is Professor John Edmonds, a member of the SAGE group, said cases were now increasing exponentially. And England's Deputy Chief Medical Officer, you heard him there earlier in the clip, Professor Jonathan Van Tam, said people had relaxed too much and must start taking the virus seriously again. Have you relaxed too much? Is it you? So 2,948 cases were recorded on Monday, according to the government data. It followed 2,988 cases announced on Sunday. This is the highest figure since the 22nd of May. I simply cannot be alone in not being surprised about this. Seeing an increase in, again, I'll caveat this. If I'm spectacularly missing a point here, please educate me and lots of other people who have this same concern. Seeing an increase in cases is surely at the moment a little like saying night follows day, right? There was always going to be an increase. It was the only thing that could surely happen. It would be medically impossible to see fewer cases in the short term as the country tries to reopen, get back to a semblance of normality. We were always going to see more cases, surely. Which means the question isn't about whether more people have COVID or have had COVID, but whether these cases have translated into hospitalizations and deaths. So far, they haven't. Now, the age group, as I'm sure you're now aware, most affected is the 17 to 21 age group, the fittest of the fit, mostly. It seems that this is the group who are not dropping like flies, but experiencing the virus in a very minor ways, in some cases not even knowing they had had it. Now, unless we've eradicated the virus, and the last time I looked we haven't, then this was always going to be the natural turn of events, yeah? Isn't this just the evolution of the virus, the natural journey? The danger point is if we start seeing people rushed into hospitals, put onto ventilators, and dying at an increasing rate. We're not seeing that, given that we pretty much know that those who are likely to be hospitalized, stuck on a ventilator, and sadly die are people who are either very old and frail or those who have incredibly serious and very deep underlying pre-existing health conditions. This then leads to what I would have thought would be obvious, a greater protection for that specific group. Now, based on what I understand we currently know, and again, I promise you, stand corrected, might be making this sound all too simplistic, surely we should continue to ease the lockdown. If we've had 3,000 people on 2 consecutive days get coronavirus and not ended up in hospital, that to me would be a sign to continue easing the lockdown, not to increase the lockdown. So if that is what has happened over the last few days, then having a greater focus on the elderly and vulnerable is the way forward. I'm not hearing Boris Johnson, Nicola Sturgeon reacting at the moment to this. I'm only hearing them react to numbers increasing when those numbers are based in the main on the 17 to 21-year-olds. What we do want to do in all of this, ideally, surely, is look after the vulnerable, look after the elderly. That's just common sense. I'm sure that is common sense. Again, stand corrected. So rather than seeing politicians talking about how this household can't mix with that whole household, second cousins can't go to a barbecue with first cousins, and all this kind of confusing palaver, which seems to be based more on postcodes than logic, what we need to see is a very simple but emphatic and robust reinstating of our care for the vulnerable group. Surely that is how this works. If we begin to see 1,000 deaths of people on ventilators on a daily basis, then you have to clearly nip something else in the bud. But if we're getting, and we'll talk to a couple of virologists on this shortly, but if you see the figure of 6,000, Sunday's figures, Monday's figures, collectively 6,000. We don't yet have Tuesday's figure, of course. But if that's the current state of play, and none of those cases translated to anyone going to hospital and therefore nobody dying, then I kind of like to think that means we're doing something right, not that we're doing something wrong. That appears that we've got a grip on this because we spent the first few months making sure, after all of the chaos and the unsavoury headlines of people not making it, but would there be enough ventilators? Is there enough PPE? Are the care homes being protected properly? We went through all of that. It would be extraordinary if we were to go through that again. So you'd kind of like to think that all those areas of vulnerability are now more protected than they ever were, as protected as they could be. I'm sure there are going to be some areas where people fall through the cracks, but broadly speaking, it would seem to me to make perfect sense that we're now au fait with that. The danger would become if, of course, 17 to 21-year-olds start mixing around with older relatives or anyone that might be vulnerable in that respect. So what I want to see right now is not a Sturgeon or a Johnson standing up telling us that postcode can't mix with that part of town is on lockdown, but if you draw a line down the middle, that part of town isn't on lockdown. You can't go to pubs there. You can get. This is all absolute nonsense. This is making no sense to me whatsoever. What I'd like to see is say, actually, based on this, it seems that particular group, unless you're going to eradicate the virus, and you're not about to do that, then we seem to have what looks like a 100% survival rate amongst the younger people. And that being the case, let's double down on our efforts to protect the older people and the vulnerable people. So if I saw Mr. Johnson pitch up at Downing Street for one of those press conferences, he hasn't had one for a while, I think there should be one, I'd be perfectly relaxed about him saying, okay, as we're seeing this increase, here's the important thing. We want this age group to go back to shielding. If you're over 75, whatever age is picked, and I know that's troublesome for some very fighting fit people who are octogenarians and beyond, but broadly speaking, if that is your age group, you are now shielding. If you have any of these health conditions, you've got chronic asthma, some kind of deep lung infection, you're vulnerable because of chemotherapy, things like that, then all of you people start shielding now. There is no going out. So the lockdown, unfortunately, has to return for those people in that respect. And most of those people will be in a situation where they have some level of help. But all the rest of us, surely by now, the only thing you can hope is that this thing goes through as many people as possible without causing any damage. Is that right? In the same way that you would expect that for any other kind of virus. I mean, if that happens, I know that there's not defined comparisons, by the way, with flu, and I wouldn't wish to make that comparison. But there are some, frankly, irresistible areas where you'd have to say, well, look, we don't apply this logic to flu. We don't apply it to the common cold. If we discover that somebody has died of any other disease, we don't put that in the headlines in quite the same way. This is, if you like, a new thing. And nobody's telling us that it's going away anytime soon. So the fact that we have a couple of people die of this each day should not be any more news by now than the fact we have a couple of people die of cancer each day, or get regrettably hit by a truck each day. It's now going to be placed in the bracket of normality in terms of things people die of. Surely. We keep being told this isn't going away anytime soon. Some projections say it could be with us for 3 years. Well, I'm sorry, if that is the case, then you've got to play it in a slightly cleverer fashion. And when I hear the chief medical dude stand up and start telling us that we're all going to die, this is terrible, look at the pattern, he's basing it on people who've had it and not died. People who've had it and not gone to hospital, not people who've had it and sadly went to meet their maker. This seems confused logic to me. I stand to be corrected. If you're listening to this from a medical perspective and you understand something I'm clearly missing here. By the way, I don't want to eradicate being sensible. I want to continue being sensible. Yeah, let's focus on the masks. Let's focus on the social distancing. For the next few months, let's run with it, because we don't fully know. We don't know how potent a virus might be as distinct from things like the flu. So there would be the difference that I would recognise. But right now, we've got 6,000 people who got the virus and probably didn't even know about it, or had very little or no effects at all. That, to me, is what I thought was going to happen as we ease the lockdown. So why is the chief science boy surprised by this? What's surprising him that's not surprising me? 0344 499 1000. It's a very simple question. Should we now be worried by this increase in COVID cases?